Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a hematologist speaking with a patient named Mr. Maxwell. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Maxwell. It's nice to meet you. I understand you're here because your GP is concerned you might be dealing with anemia. Can you tell me a bit more about the symptoms you've been experiencing?
Sure. Well, I've been feeling exhausted lately. It's like no matter how much I sleep, I'm just always tired. My wife keeps telling me to check it out because I'm a bit pale too, and just last week, I felt a little lightheaded when I stood up, but it passed after a few seconds.
I see. So, fatigue, some paleness, and occasional lightheadedness.
Exactly. I figured maybe it was stress from work. I'm a carpenter, so it's physical work, but I don't think I should be this tired. Also, I noticed I get short of breath easily, even with simple tasks. Climbing the stairs can leave me feeling out of breath, which isn't normal for me. I'm usually pretty fit.
Thank you for sharing all of that. Those can indeed be symptoms of anemia, but we'll need to run a few tests to determine the exact cause and type if that's the case. Have you had any recent blood work done?
Yes, my GP had me do a blood test about a week ago. She mentioned that my hemoglobin was low, and my iron levels were also below the normal range, which is why she suggested I come see you.
Low hemoglobin and iron levels can certainly point towards anemia, particularly iron deficiency anemia, which is quite common. There are several other types of anemia, but this is often linked to iron levels, which we'll discuss in detail.
That makes sense. My wife thought maybe it was related to my diet. I'm not a big meat eater, and I heard that can make a difference, right?
Yes, absolutely. Iron-rich foods like red meat, beans, lentils, and dark leafy Maxwells are key sources. If you're not consuming enough iron, it can gradually lead to a deficiency, especially if your body is using more iron than usual. For instance, if you've recently increased your activity level or had any bleeding, even minor cuts or nosebleeds, your iron needs could be higher.
That's interesting. I don't eat much red meat, and I haven't really thought about it. No bleeding, though. I'm usually careful at work, but I have started biking to work, which is new for me.
That's a good insight. It could contribute, especially if your body is adjusting to the new physical demands. There's also a possibility that your body may have difficulty absorbing iron efficiently. Conditions like celiac disease, for example, can affect absorption, as can certain medications.
I see. I haven't been diagnosed with anything like celiac, but I do have acid reflux, so I take medication for that. Would that impact my iron?
Yes, some medications for acid reflux, such as proton pump inhibitors, can decrease stomach acid, which is needed to absorb iron properly. We can explore if that might be a factor in your case.
Okay, that makes sense. So what's the next step?
First, we'll want to confirm your iron levels with a more detailed blood test, which includes a complete iron profile. This will tell us how much iron is stored in your body, not just what's circulating in your blood. I'll also check for vitamin B12 and folate levels, as these nutrients are also important for red blood cell production. Deficiencies in these can cause anemia as well.
And after that, if it's just low iron, what are my options?
Great question. If it's primarily iron deficiency, we can look at dietary changes to help increase your intake of iron-rich foods. If you're open to it, a multivitamin with iron might help, but we could also consider iron supplements. There are also treatments we could explore if absorption is an issue.
I think I'd be okay with that. I'd like to avoid feeling this tired all the time.
Of course. We'll work together to find what's manageable and effective for you. It may take a little time, as increasing iron levels usually happens gradually. Typically, with the right approach, most people start noticing an improvement in energy within a few weeks.
That sounds good. I'd just like to have a bit more energy back. The lightheadedness has also been worrying me.
Understandably so. Anemia can reduce the oxygen-carrying capacity of your blood, which can contribute to lightheadedness or dizziness. Rest assured, we'll monitor your symptoms closely and ensure the treatment helps with that too.
Thanks. It's reassuring to hear. And I suppose I should look into adjusting my diet?
Yes, that would be a helpful step. You might focus on incorporating more iron-rich foods into your meals and pairing them with foods high in vitamin C, like citrus fruits and tomatoes, as it helps with iron absorption. Avoid having tea or coffee directly with meals, as they can interfere with iron absorption.
Extract 2, questions 13 to 24. You hear a general practitioner speaking with Mr. Thomas. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. Good afternoon, Mr. Thomas. How are you feeling today?
I'm managing. To be honest, I'm still trying to adjust. Everything feels different now.
I can imagine this must be overwhelming. Adjusting to life after a spinal cord injury is a big change. I'm here to support you through this, so let's take things one step at a time. How have you been coping with your condition over the past few weeks?
Well, since the accident, I've been in a rehab center. They're doing their best, and I've made some progress with the therapy, but I still feel so frustrated. I can't move anything below my neck, and it's hard to accept that this is my new reality.
I understand. Being diagnosed with quadriplegia or tetraplegia following a spinal cord injury can be a life-changing experience. It's natural to feel frustrated. But remember, your progress in rehab is important, and there are many resources and support systems to help you regain as much independence as possible.
Yeah, but will I ever regain any movement? Or is this it for me?
Recovery after a spinal cord injury can vary significantly from person to person. It largely depends on the level and severity of the injury. In your case, the injury occurred in the cervical spine, which is why you're experiencing quadriplegia, meaning paralysis in both your arms and legs. However, some people do regain limited movement or sensation with time and therapy, but it's difficult to predict the extent. What's important is that the rehabilitation team is working with you on strengthening the muscles you can control and managing any complications related to the injury.
So what does the rehabilitation process actually look like from here? Am I just stuck in physical therapy forever?
The rehab process is multifaceted and designed to help you adjust and maximize your functional abilities. Physical therapy will continue to focus on improving your strength, range of motion, and preventing secondary complications, like muscle atrophy and joint stiffness. You'll also work with occupational therapists to help you learn new ways to perform everyday tasks using adaptive equipment, like voice-activated devices or specialized wheelchairs.
It feels like so much to handle. I've never even thought about needing all these devices before.
It's completely understandable to feel overwhelmed. The good news is that adaptive technology has made significant strides, and many people with quadriplegia can lead fulfilling lives with the right support. We'll take it one step at a time. You'll also have access to a psychologist or counselor to help manage the emotional toll this transition might have on you.
Yeah, the emotional part has been tough. I used to be so active, and now I can't even get out of bed without help.
That sense of loss is one of the most challenging aspects to deal with, and it's important to acknowledge those feelings. It's okay to feel frustrated, sad, or angry. But over time, and with the right support, you'll find ways to adapt. We'll also focus on managing your physical health to avoid complications, which will help improve your quality of life.
Speaking of that, what kind of complications should I be worried about now?
There are several potential complications that we need to keep an eye on. With quadriplegia, muscle weakness and loss of sensation can lead to problems like pressure ulcers. So it's important to have a proper skin care routine and change positions regularly, even in bed. There's also a risk of respiratory issues, since higher-level spinal cord injuries can affect breathing. Are you using any respiratory support right now?
Yeah, I'm using a ventilator at night.
That's good. The rehab team will continue monitoring your respiratory function to see if you can gradually reduce that support over time. Additionally, we'll watch for any issues with bladder and bowel function. These systems can be disrupted after a spinal cord injury, so you'll likely continue working with a urologist and possibly use a catheter to manage this.
That's been one of the most difficult adjustments. I never thought I'd have to deal with something like that.
It's a difficult transition, but with time, many patients learn to manage these aspects of their care more independently. We'll also make sure you're comfortable with the necessary tools and that your care team provides ongoing support.
What about pain? Sometimes I feel this strange pain in my arms or legs, even though I can't move them.
That's what we call neuropathic pain, and it's common in people with spinal cord injuries. It can feel like burning, tingling, or sharp pain, even in areas where there's no sensation. We can manage this with medication, and I'll discuss some options with you that might help alleviate it. We'll also continue to monitor how it changes over time.
I didn't expect to feel pain in places where I'm paralyzed.
It's one of the unique challenges of spinal cord injuries. Neuropathic pain can be unpredictable, but there are therapies and That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nutritionist talking to a patient. Now read the question.
So, what brings you in today?
I've been feeling tired, and I'm worried something might be wrong. I read online that I might have a vitamin deficiency, but I'm not sure if it's serious or just my imagination.
Well, I'm glad you came in to discuss this. Vitamin deficiencies, like vitamin D deficiency, can indeed impact your health. For example, low levels of vitamin D affect bone health and immune function, so it's good to check.
Oh, I didn't realize vitamin D was so important. I thought it was just for bones.
That's understandable, and you're not alone. Many people think it's just about bones, but vitamin D also plays a role in immune support and overall well-being. When we don't get enough, it can affect our energy and immune system and even increase certain health risks over time.
Now look at question 26. You hear a morning briefing on a ward. Now read the question.
An 85-year-old man with a history of chronic kidney disease and hypertension. He presented with severe dehydration after vomiting for 3 days. On examination, he had dry mucous membranes, poor skin turgor, and an elevated heart rate. Lab results show a significant electrolyte imbalance, including low sodium and potassium levels.
Okay, what are the next steps?
Based on the findings, fluid resuscitation with normal saline and electrolyte correction will be the immediate priorities. We'll also need to closely monitor his renal function and electrolyte levels.
Now look at question 27. You hear a trainee doctor discussing an echocardiogram result with a senior cardiologist. Now read the question.
Dr. Sarah, I have a question regarding the 56-year-old patient's echocardiogram findings.
Sure. Have you reviewed the echocardiogram thoroughly?
Yes, I have. I can see significant thickening of the left ventricular wall, which seems consistent with left ventricular hypertrophy. Wouldn't this finding support the diagnosis of long-standing hypertension?
Yes, it does. But there's an additional concern here. The patient's atrial size and the presence of diastolic dysfunction indicate a risk of progressing towards heart failure. Also, considering his history of poorly controlled hypertension is quite important in this context.
I see. I hadn't factored that part in.
Now look at question 28. You hear a presentation about the introduction of a new type of wound therapy. Now read the question.
Thank you for joining us today. After careful consideration, the hospital has decided to invest in a new wound care method known as negative pressure wound therapy or NPWT to better treat our patients with complex wounds, such as pressure ulcers and diabetic foot ulcers. Traditional wound care methods often involve dressings that need to be frequently changed to keep the area clean and dry. However, NPWT goes a step further by applying a gentle vacuum to the wound site. This vacuum not only removes excess fluid but also boosts blood circulation and stimulates the growth of new, healthy tissue, known as granulation tissue. Though this therapy involves specialized equipment and requires proper setup, we believe its benefits for complex wounds are substantial and will support faster, more effective healing.
Now look at question 29. You hear two colleagues discussing about preparation of a program. Now read the question.
So, how's the preparation going for launching the new mental health support program?
Well, we've made good progress with identifying potential counselors, and there's already interest from staff about attending group sessions. However, I'm finding it a bit challenging to finalize a robust confidentiality protocol. Given the sensitivity of mental health support, I want to ensure that staff feel secure about their privacy. Do you have any experience with implementing similar measures?
Yes, absolutely, you're right. That's a priority for a program like this. I'll talk to my team and see if we can come up with some recommendations for confidentiality standards that have worked well in similar settings.
Great, thank you. I appreciate it.
Now look at question 30. You hear a conversation between a mental health nurse and a doctor about managing holistic care. Now read the question.
I've already spent over an hour reviewing the mental health care plans for this morning's group of patients living with AIDS. I'm trying to decide which patients need a psychiatric consultation and which can continue with just counseling.
Okay, let me see if I can assist you with that. We are already stretched today with the extra case reviews and some of the patients needing more in-depth support due to severe anxiety and depression.
Yes, every day is a balancing act between their mental health needs and the ongoing management of their physical condition.
That's definitely true. I still have to complete an hour's worth of reports and go through routine administration tasks, including medication reviews. I wish we had more dedicated mental health resources, especially until our colleague specializing in HIV mental health returns.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview with Mrs. Jess Allen, a sustainability officer and registered nurse. You now have 90 seconds to read questions.
Hi everyone, today we're here with Mrs. Jess Allen, a sustainability officer and registered nurse working with the National Nurses for Climate Action. She has been instrumental in implementing eco-friendly practices within hospitals and nursing care centers across the country. She began her career in general nursing, but shifted her focus to environmental health about 5 years ago. Mrs. Allen, could you start by telling us what initially inspired you to work towards sustainable practices in nursing?
Of course. I've always been passionate about environmental issues, but I didn't initially connect it with my career in healthcare. Over time, though, I began to see how wasteful many common healthcare practices are, especially in hospitals. I wanted to work on ways to minimize this waste while maintaining quality care, and I saw there was a real need for advocates within healthcare who understood both nursing and environmental sustainability.
That's such an important perspective. In your experience, what are some of the biggest environmental challenges that hospitals currently face?
I think one of the biggest challenges is the amount of single-use items we rely on daily, things like gloves, syringes, and other disposables that we discard after just one use. It's understandable from an infection control standpoint, but it's not always necessary to be so waste-heavy. Another issue is energy consumption. Hospitals run 24/7, and they consume enormous amounts of energy. Reducing energy use and moving towards renewable sources is crucial to make a significant impact.
Absolutely, reducing waste and energy use are critical. How do you think nurses can help tackle these issues?
Nurses can play a huge role. First, we can advocate for the use of reusable items whenever it's safe to do so. For example, some facilities are switching to reusable gowns or equipment, which can dramatically reduce waste. We can also help by promoting better waste separation, sorting recyclables, compostables, and hazardous waste correctly. Finally, nurses can educate both patients and staff about sustainable practices. Small things like encouraging patients to bring their own reusable water bottles instead of using single-use plastic can add up.
Interesting. I'd imagine that could be challenging to implement across a whole facility. Are there other barriers you encounter when promoting eco-friendly initiatives?
Yes, definitely. One of the main barriers is cost. Sustainable items often have a higher upfront cost, even though they save money in the long run. Another challenge is the resistance to change. Many healthcare workers are used to certain protocols and don't want to disrupt routines that have been in place for years. But through education and leadership, we're slowly making headway.
That's encouraging to hear. I know the topic of green practices is gaining attention, but are there specific changes you'd like to see at the policy level to make eco-friendly practices more common?
Definitely. For instance, I think more hospitals should adopt comprehensive sustainability policies that mandate waste reduction targets and incentivize renewable energy sources. We also need more research into eco-friendly products specifically designed for healthcare, as well as funding for training programs focused on sustainability. Lastly, I'd like to see hospitals develop partnerships with local recycling and composting facilities to ensure waste is managed responsibly.
Those sound like impactful changes. Now, one last question before we wrap up. What do you think the average person, whether a patient or healthcare worker, can do to support these eco-friendly goals?
For healthcare workers, it's as simple as staying mindful of resource use, turning off lights and equipment when they're not needed, for example. For patients, bringing reusable items and opting for digital paperwork instead of paper can help reduce waste. It's all about creating a culture of sustainability where everyone plays a part, however small.
Thank you so much, Mrs. Aylan. This was really insightful, and it's great to see how sustainability can be integrated into healthcare.
Thank you for having me. I hope this encourages more people in healthcare to think green.
Extract 2. Questions 37 to 42. You hear a presentation by a specialist in medical communication called Dr. James Hawthorne. Now read the questions. You now have 90 seconds.
Hello everyone, I'm Dr. James Hawthorne, a specialist in medical communication. And today I'd like to talk about one of the most important yet sometimes overlooked aspects of healthcare: empathy in physician-patient communication. Many of us know that clinical expertise is crucial, but empathy plays an equally significant role in patient outcomes, treatment adherence, and overall satisfaction. My goal today is to help us understand why empathy is vital in healthcare and explore ways to improve this skill in medical professionals. So, why is empathy so important? Empathy involves not just understanding what the patient is going through, but also being able to communicate that understanding back to them. It's about connecting emotionally with the patient, validating their feelings, and acknowledging the psychological and social factors that can affect their health. When patients feel heard and understood, they are more likely to trust their physician, share important information about their condition, and follow prescribed treatments. Research has shown that empathy can directly influence clinical outcomes. Studies suggest that patients who perceive their physicians as empathetic are more likely to adhere to treatment plans, report fewer symptoms, and experience better recovery outcomes. For instance, in one study of patients with diabetes, those who rated their doctors as empathetic had better control of their blood sugar levels over time. This is likely because patients who feel supported are more motivated to manage their conditions and maintain healthier behaviors. However, empathy isn't just beneficial for patients, it's also essential for doctors. Physicians who practice empathy tend to have higher job satisfaction and lower burnout rates. In a profession where emotional stress is high, maintaining an empathetic approach can help doctors feel more fulfilled in their work. It also fosters better communication within healthcare teams, improving collaboration and patient care. Despite the clear advantages, one of the challenges we face is that many medical professionals struggle to consistently express empathy. This is especially true in high-pressure environments like emergency rooms or busy clinics, where time constraints and the need to make quick decisions can make it difficult to engage with patients on an emotional level. As a result, many patients report feeling rushed or dismissed, which can undermine the trust in the physician-patient relationship. So how do we ensure that healthcare professionals can develop and maintain empathy, even in stressful situations? One solution is training. Medical schools and hospitals are increasingly recognizing the importance of communication skills training that includes empathy development. These programs often use role-playing exercises, where physicians practice patient encounters in controlled environments, receiving feedback on how well they listen, express understanding, and respond to patient concerns. There is also an increasing emphasis on reflective practice, where physicians are encouraged to reflect on their interactions with patients and consider how they can improve their approach. Another approach involves the use of mindfulness techniques to help doctors remain present in the moment, even when under stress. Mindfulness training helps medical professionals tune out distractions, focus on the patient in front of them, and respond to the emotions expressed by the patient. This not only improves the patient's experience but also allows physicians to feel less overwhelmed by the many demands of their job. There's also the importance of creating a healthcare environment that supports empathy. Hospitals and clinics can foster a culture of empathy by promoting teamwork and encouraging staff to prioritize patient-centered care. This might involve adjusting schedules to allow physicians more time with patients, or providing support staff who can handle administrative tasks so doctors can focus on patient care. Technology, while often seen as a barrier to human interaction, can also play a role. Some healthcare systems are exploring ways to use electronic medical records to flag patients who might be experiencing distress, prompting physicians to take a more empathetic approach during consultations. Moreover, empathy in healthcare goes beyond the one-on-one interaction between doctors and patients. It extends to the way healthcare systems treat patients overall. For example, hospitals that are designed to be more comfortable and patient-friendly, with spaces that promote relaxation and well-being, can enhance the healing process. Patient satisfaction often improves when the physical environment reflects an understanding of their emotional needs, and this ties back into the broader concept of empathy in healthcare. In conclusion, empathy is not an optional extra in healthcare. It is a core component of effective medical care. It enhances patient outcomes, strengthens the physician-patient relationship, and contributes to the well-being of both patients and doctors. While challenges such as time pressures and stress exist, there are clear strategies that can help integrate empathy more fully into healthcare practice. By prioritizing empathy training, fostering supportive environments, and encouraging reflection, we can ensure that physicians are better equipped to connect with their patients on a deeper level, leading to improved outcomes for everyone involved.
That is the end of Part C. You now have 2 minutes to check your answers.